Have you ever pondered the immense complexity of the human brain and its intricate network of nerves? It's a marvel, isn't it? This delicate labyrinth holds the key to our very essence. It's the control center that orchestrates our actions, our thoughts, our feelings, and it's this very complexity that makes the neurological examination such a vital tool in the realm of medicine. A neurological examination, you see, is a comprehensive assessment of the nervous system in action. It's akin to a symphony conductor tuning into each instrument, ensuring they're playing in harmony. It's a fine-tuned process that can reveal volumes about a patient's nervous system function. From the Glasgow Coma Scale to the assessment of 12 cranial nerves, from motor and sensory examination to gait assessment, each step is a crucial piece in the diagnostic puzzle. So, a neurological examination is not just a routine checkup. It's a detective's work, deciphering the clues the human body offers. First stop on our journey is the Glasgow Coma Scale, a critical tool in assessing consciousness. This scale, used worldwide, provides a practical method for gauging the depth of unconsciousness and tracking changes over time. It's a tripartite scale, assessing three key areas: eye-opening, verbal response, and motor response. Let's discuss about these categories. Eye-opening is the simplest, gauging the patient's ability to open their eyes spontaneously or in response to stimuli. Verbal response measures the coherence and appropriateness of a patient's speech, while motor response looks at physical reactions to commands or pain. By scoring these three components, clinicians can get a snapshot of a patient's consciousness level. This isn't just about numbers, though. Each score provides a piece of the puzzle, painting a picture of the patient's neurological state. Understanding the Glasgow Coma Scale is like learning a new language, one that translates the human consciousness into measurable terms. Welcome back, as we delve into the fascinating world of the 12 cranial nerves next. These nerves, our direct gateways to the brain, play a pivotal role in our day-to-day functioning. They enable us to see, smell, taste, and even control our facial expressions and voice. They are truly the unsung heroes of our sensory and motor systems. You might wonder why we put so much emphasis on examining these nerves. The reason is clear. Assessing their function helps us detect early signs of neurological disorders. Yes, from strokes to tumors, these nerves provide us with crucial clues that aid diagnosis. But how do we examine them? The process is straightforward yet meticulous, involving specific tests for each nerve. We use vision tests for the optic nerve, facial sensation tests for the trigeminal nerve, and hearing tests for the auditory nerve, to name a few. As we end this section, let's not forget that the cranial nerves are the silent workers, keeping our senses sharp and our movements smooth. Like our body's private detectives, they help us understand the health of our nervous system better, aiding doctors in making accurate diagnoses and providing effective treatment. Now let's discover the wonders of motor and sensory examination. In the intricate world of human biology, motor and sensory examinations play a pivotal role. They serve as a conduit to understand the body's internal dialogue. Motor examination, for instance, is like a conductor guiding an orchestra. It assesses muscle strength, tone, and coordination, helping us unveil any abnormalities that may indicate neuromuscular disorders. The examination is conducted by a series of physical tests that challenge the body's motor skills. On the other hand, sensory examination is like an attentive audience, capturing the subtle whispers of the body. It evaluates sensory nerve function, detecting changes in temperature, touch, vibration, and pain perception. This examination is performed through a range of tests, designed to challenge the body's sensory responses. Together, these examinations form a comprehensive understanding of the body's communication network. They provide invaluable insights into the body's overall health, unveiling what's beyond the surface. Motor and sensory examinations are like a symphony, harmoniously communicating the body's needs and responses. Ever marveled at the reflexes of a newborn or an infant? These seemingly simple reactions are actually our first glimpse into a child's neurological development. Newborn reflexes, such as the rooting reflex, where a baby turns its head toward anything that strokes its cheek, the Moro reflex, a startle response, the palmar grasp, where the infant's hand will grip an object placed in it, and the plantar grasp, which is similar to the palmar grasp but occurs when the area near the base of the toes is touched, are key indicators of a healthy nervous system. These reflexes are not just cute, they're crucial. They are the body's earliest means of interaction with the world, a basic form of communication before language develops. They also provide early signs of potential neurological issues, allowing for prompt intervention if needed. Examining these reflexes is a delicate art. The clinician gently stimulates the infant to trigger the reflexes, observing their response. The absence, persistence, or abnormality of these reflexes beyond certain ages can indicate developmental delays or neurological conditions. Infant reflexes are the first chapter in the fascinating story of human development. Let's turn our attention now to gait assessment and deep tendon reflexes. Gait, or the process of walking, is a complex activity that relies on a balance of strength, coordination, and sensory input. The way we walk can reveal a lot about our overall health and neurological function. Gait assessment helps identify any irregularities in the walking pattern. A patient's stride, balance, arm swing, and foot clearance are all evaluated. Any abnormal findings could indicate conditions like Parkinson's disease, stroke, or muscular dystrophy. Then we have deep tendon reflexes, which are involuntary responses triggered by a sharp tap to specific areas of the body. These reflexes provide a snapshot of the integrity of the spinal cord and peripheral nerves. The strength and speed of these responses can help identify nerve damage or degenerative diseases. Gait and reflexes, like an artist's signature, are unique to every individual and tell us so much about their health. Finally, we delve into the realm of meningeal signs and common neurological symptoms. The meninges, the protective layers sheathing our brain and spinal cord, can sometimes signal distress. These signs, fittingly termed meningeal signs, can be indicative of grave conditions such as meningitis or subarachnoid hemorrhage. Symptoms may encompass severe headache, neck stiffness, and sensitivity to light. Further, we have three more significant signs to discuss. One is nuchal rigidity. This is a telltale sign of irritation to the meninges. It manifests as resistance and pain on passive flexion of the neck. Following this, we have the Koenig sign. A positive Koenig sign occurs when the thigh is bent at the hip and knee at 90-degree angles, and the subsequent extension in the knee induces pain. The third sign, Brudzinski sign. This sign is considered positive when forceful flexion of the neck leads to involuntary flexion of the knee and hip. Now let us shift our attention to some common neurological symptoms. These are the body's red flags, raised high and signaling potential problems. They can vary from changes in memory, attention, or even mental status to physical symptoms like muscle weakness, numbness, or loss of balance. Each symptom contributes to the puzzle, offering valuable insights into the patient's neurological health. Remember, these signs and symptoms are not to be dismissed. They're not mere random occurrences, but intricate messages from the body's command center, the nervous system. Meningeal signs and neurological symptoms are the body's SOS, alerting us to looming issues beneath the surface. Let's do a quick recap. We've talked GCS scale, cranial nerves assessment, examination of the motor and sensory systems, our body's communication network, and the importance of checking for early signs in newborns and infants through reflex testing. Additionally, we've shed light on gait assessment, the study of our walking pattern, and deep tendon reflexes, which offer valuable insights into our neurological health. And let's not forget the meningeal signs and common neurological symptoms that serve as warning signs, calling for immediate medical attention. In the end, a neurological examination is not just a medical routine, but a profound exploration of the human body's most complex system. Now let's delve into the intriguing world of the Babinski reflex. This reflex is a fascinating neurological sign that plays a key role in both infants and adults. For infants, a positive Babinski reflex is a normal part of their development. It's when their big toe flexes toward the top of the foot and the other toes fan out when the sole of the foot is stimulated. However, in adults, a positive Babinski reflex could indicate potential damage to the nervous system. How is this reflex tested, you ask? It's quite simple. A doctor or medical professional will gently stroke the outer sole of the foot with a blunt object, observing the response. A normal response is when the big toe points down and the other toes curl in. However, if the big toe points up and the other toes fan out, it could suggest an underlying issue with the nerves or the brain. The Babinski reflex, a simple movement of the toes, can reveal substantial information about our neurological health. It's another testament to the power and significance of neurological examinations in understanding and diagnosing potential issues in our complex nervous system. As we conclude our journey, it's important to remember that this is just the beginning. The aspects of neurological examination we've covered, from consciousness indicators, gateways to the brain, the body's communication network, early signs, walking patterns, warning signs, to the Babinski reflex, are merely the tip of the iceberg. Neurological examination is a vast and incredibly complex field, requiring detailed knowledge and extensive experience. The intricacies of the human nervous system are such that even the smallest of changes can indicate significant health issues. Therefore, mastery in neurological examination requires continuous learning, practice, and an unquenchable thirst for knowledge. Remember, the human brain is a marvel, and understanding it is a lifelong journey. The more we learn, the more equipped we become in diagnosing and treating potential neurological issues. So, keep that curiosity alive. And let's continue exploring the fascinating world of neuroscience together in our next video. Until then, stay curious, stay learned.